All right, so we're here today to talk about early childhood and pre-K programs, and we're focusing on who that includes and how students qualify, as well as what the program provides for those who do qualify. An ounce of prevention is worth a pound of cure. When we think about that, what we hope comes to mind is that by being proactive in the beginning of a child's life, we can take measures that lead to a more successful outcome instead of being reactive once it's too late. Why do we need to intervene at such a young age? A study done by, or several studies done over the course of a decade found that students or children um, were more likely to graduate from high school, less likely to drop out if they were involved in a program like Head Start from early childhood. It also showed that the longer that they participated in the program, the higher the success rate was. So, who qualifies for these early childhood and pre-K programs in public schools? Usually, this is children who are under the age of 5, most commonly between the ages of 3 and 5. They If they are going to receive special services or enter the program because of a disability, it must meet the guidelines or the eligibility requirements for special education or IDEA in the state of Texas. And anybody can refer a child to be tested or assessed for the program. That can be parents, a pediatrician, or through the district screening process. When we talk about early childhood programs, especially those that are inclusive of special education or disabilities, there are 3 programs that meet the needs of students before the age of 5. Those are infant and toddler programs, integrated early childhood and special education programs, and then when the programs are separate, early childhood and special education programs. All of these programs meet the developmental needs of students, of the children that are in the program. Most of these programs use a document similar to an IEP to set the program accommodations. It's called an IFSP, and the F in that acronym is for family, because in these programs, families are included in the process, mostly so that interventions can also happen at home, because when interventions are happening at home in connection or in coordination with early childhood programs in the school setting, they are more successful. So when we're talking about special education programs that can be provided to students, again, this is for children birth to school aged. And if they qualify for special education services, these services can include family training, where somebody comes in to observe the family environment and help to develop a plan for intervening at home. It can include home visits, where for example, if a student is blind or deaf, somebody can help to develop routines for the family to help the child be successful at home as well. And then there's speech therapy, occupational therapy, and physical therapy, which can be provided in the home or through an independent provider. And then in addition to that, as the student gets older and transitions from these early childhood programs into the pre-K program or kindergarten program, there are transition services to help adapt to the new learning environment. When we talk about who supports the program, it's literally a team effort. This diagram kind of just depicts all of the different pieces of the puzzle. The focus is on the child, but the campus and the family are the kind of moving parts to that coordinate a plan for the success of the child. but behind the family are usually a host of specialists, interventionists, and then the family doctors who help to make the best recommendations. Additionally, behind the campus is usually a district support services team, um, depending on the disability or the need of the child, as well as federal, state, and local government guidelines that the school district has to follow. So a quote that stood out and kind of encompassed the whole idea of the importance of pre-K was this one. It says, "The goals of pre-kindergarten programs may only be achieved if programs ensure high quality teacher-child interactions and at least moderate quality instruction. These findings indicate that social outcomes were more strongly influenced by the quality of the teacher-child interactions, but only when teachers are actively and positively engaged with children." So when we're talking about pre-kindergarten programs, it is very important that we are investing in the teachers in these programs and the curriculum that these teachers are providing to the students and the environment that they're creating, so that we are providing this positive engagement between the teacher and the child. When a student is in the pre-K program in the state of Texas, there are 3 ways that the student is monitored to make sure that they are succeeding in this program. Those 3 measures are screening measures, which happen at the entry of the program, progress monitoring measures, which are ongoing and usually smaller assessments or informal assessments to gauge the success of the student throughout the program, and then diagnostic assessments, which are more in-depth analysis. And these are usually used to identify specific disabilities and to put specific supports in place. Lastly, before we go, some common misconceptions that we hear when we are talking about early childhood programs and pre-K programs are that the intent of early childhood programs is strictly to give kids an advantage cognitively, to work on them gaining academic success early on or getting a head start with that. But in actuality, early childhood teachers say that what's most important is allowing these children exposure and the ability to build healthy lifestyles, to be well rested, to provide nourishment through the programs, as well as providing them the skills to communicate their needs and their wants and their thoughts, as these are life skills that will better set them up for success throughout their life and their academic life. The second misconception is that sometimes we see obnoxious behaviors in young children, and we assume that these are learned behaviors from the overall culture in the home environment. But actual research shows that nearly 1/3 of these children who live in urban districts suffer from actual PTSD, post-traumatic stress disorder, and what we often perceive as a learned cultural behavior is actually a child illustrating coping and surviving mechanisms, not actual learned behaviors. So that's a general overview of the early childhood programs and pre-K programs in the state of Texas. You can always refer to TEA for general guidelines in how to implement and to follow both of these programs in our schools.